Hello everyone, Clover Medical Center is live again. I'm Dr. Neha. I'm a dentist working at Clover. I specialize in gum treatment as I have done my master's in periodontology. Today I'm going to speak about one of the most common problems patients present with, bad breath. I will speak about why it is important to know about bad breath, what are the possible causes, how you can check if you have it or not, and how it can be prevented or treated. You can ask questions in the comment section and I will be happy to answer them at the end of my talk. Before I start, let me share this on my timeline. So let's start with why it is important to know about or treat bad breath. Some reasons are obvious. Of course, it's embarrassing when someone points out that you have bad breath. Also, if you know that your mouth smells bad, it can be very hard on your self-esteem. You may want to withdraw from socializing and meeting people, and it can indirectly affect your confidence levels. Also, the bad taste it may leave in your mouth can be distracting and affect your routine day-to-day activities. Most importantly, it may be cause for greater concern, indicating an ongoing disease, for example, kidney or a liver disease, and even diabetes. So bad breath cannot and should not be ignored. Now let's speak about what can cause bad breath. Most of the time, bad breath is caused by bacteria present in the mouth. When this bacteria acts on food particles on the teeth, gums, and very importantly, the tongue, it releases sulfur-containing gases which cause bad breath. So if the food is cleaned out regularly, there is generally no problem or foul smell from the mouth. But in cases where it stays behind, it creates an issue. Therefore, it is very important to keep your gums, teeth, and tongue clean. Like if you have cavities or holes in your teeth. Most commonly, in around 90% of the cases, bacteria and coating on the tongue is responsible for bad breath. Another very important factor that can cause bad breath is a dry mouth. Your saliva is really important to flush away the extra food particles in the mouth. It has a cleansing action. So if there is less saliva, food will not be cleared from the mouth and bacteria will act on it, causing a foul smell. So what causes you to have a dry mouth? A dry mouth occurs when you don't drink enough water or you have been sleeping or traveling, in which case your body slows down the production of saliva. For example, when you wake up in the morning, you have bad breath. 99% of people suffer from this condition. This is because when they sleep, the flow of saliva is dramatically reduced and the cleansing action is therefore very less. Dry mouth can also occur because of mouth breathing. That is, if you breathe through your mouth instead of your nose. This happens if you suffer from conditions that can lead to a blocked nose, such as a nasal polyp or adenoids. It is also seen in people who work out a lot or athletes who spend a lot of time undergoing physical training. Certain medications like the ones that are used for allergies or muscle relaxants can also cause a dry mouth as a side effect. So all these conditions mentioned can cause dry mouth indirectly, leading to bad breath. Sometimes bad breath is caused by the food we eat. Pungent food like garlic and onions are infamous for producing unpleasant odor. But there is also other culprits that you may not know about. For example, cabbage, cauliflower and Brussels sprouts. These foods are also high in sulfur, which can produce an unpleasant odor. Another reason why your mouth can smell bad is if you smoke. Not only does smoking produce bad smelling compounds in the mouth, but it can also lead to dryness of the mouth. Another cause that I would like to speak about is alcohol. Alcohol lingers on your breath long after the intake. It dries up your mouth just like smoking. One reason that may cause bad breath and very few people know about is a low carbohydrate diet. These days more and more people are on a strict diet. Like, for example, I had this patient who's a model by profession. On the day she had come for a dental cleaning, she complained of bad breath. But when I checked her mouth, there was no cavities, no tartar or anything. She actually had a very clean mouth. Her breath smelled a bit fruity. So when I asked her, she told me how she barely eats any bread, rice or any carbs. So this situation may arise in the absence of carbohydrates, as proteins get broken down for energy in the body and a product called ketone is released that smells like fruit. Apart from these, certain general health conditions may also lead to bad breath. For example, conditions like sinusitis. When you have sinus infection, a lot of mucus is produced that sometimes drips down to your throat and settles at the back of your tongue, causing a foul smell. Bad breath can also occur if you have stomach issues or digestive issues such as acidity or indigestion. Even conditions like diabetes or kidney problem can lead to a distinct odor in your mouth. If you have diabetes, your breath might smell fruity or it can be fishy in case of kidney problems. So these are the most common causes of bad breath. Now before we move on to talking about how to treat bad breath, let's talk about how you can check if you have it or not. Bad breath can be of different types depending on the source and the cause. Some people worry too much about their bad breath even though they don't have it or they have very little mouth odor, while others have bad breath and don't even know about it. There are several breath tests that you can perform on yourself to check what your breath smells like. These methods may not tell you exactly what other people smell, but they should give you a good indication. The first test that you can do is called the sniff test. So what you basically have to do is lick your wrist, draw it for a moment and then smell it. Something like this. Avoid trying this test just after you've brushed your teeth, used mouthwash or eaten something minty because it may give you inaccurate results. So when you smell the inside of your wrist where the saliva has dried, that is more or less what your breath smells like. If this smells unsavory, then you may need to improve your dental hygiene and overall health. If it doesn't smell like anything, then your breath probably isn't too bad, but you might need to try another self-test to be sure. Another test is that you can take requires a spoon or a gauze piece, and what you have to do is stick your tongue out and look for any coating on it. And you scrape it starting from the back, moving in the forward direction. Once you are done, smell it and also take a good look at the gauze piece. If it has yellow, brown or any other color, it implies you have breath problems. Another way to check your breath is by asking someone else what they think. This is a very reliable test to confirm a breath problem. This is because the human nose tends to ignore any smell which is constantly there. So even when we do previous tests, it is sometimes hard for us to smell ourselves. Another good reason why getting an opinion from someone else is a good idea is a condition called pseudohalitosis, wherein a patient suffering from it is under the impression that they have bad breath, but they actually don't. So in such cases, asking someone else for their opinion can be very valuable. So who makes a good person to ask? Someone you can trust. Your close friend or your spouse can be a good candidate. You can ask your dentist or your hygienist as well. If that's too personal for you, try asking your kid. Sometimes the most honest answers come from children. So, if you do have bad breath, what do? First and foremost, we have to understand the difference between masking or covering bad breath and treating it. It can only be treated by treating the cause. So finding out its cause is the first step. If you have bad breath only when you wake up in the morning, have no fear. Morning breath is completely normal for most people and can be reversed with simple oral hygiene procedures. But if you have bad breath throughout the day, it can be a cause of concern. First and foremost, check your oral hygiene habits. Brush properly after every meal and floss regularly. And most importantly, as your tongue is where most of the foul smell creating bacteria are present, it has to be cleaned properly. So what is the right way to clean your tongue? First and foremost, choose a good tongue cleaning device. This is how it looks like. It can be made of stainless steel, plastic or silicone. You can choose whichever one you prefer. The stainless steel ones are more durable. The plastic ones are much less expensive but are not as durable. The silicone scrapers may help you make scraping your tongue a little more comfortable. You can also use a soft brush. So what you have to do is extend your tongue out fully first. This is so that you can access the full length. You will want to make sure that you clean as much as your tongue as you can. By extending it all the way, it will also help to avoid gagging. So if suppose this is your tongue, you can scrape or brush your tongue from the back of the tongue to the front. As you do that, you will get a buildup or a residue on the tool. You can easily rinse it off and continue the same till you have worked over your whole tongue. Be gentle. Do not put much force as it may cause an injury to the tongue. As I mentioned earlier, one of the reasons you may have bad breath is a dry mouth. So have plenty of water every day. If smoking is the cause for your bad breath, cut it down. If you have alcohol, have lots of water with it to keep yourself hydrated and maintain the saliva flow. So in a nutshell, to treat bad breath, first find out whether you actually have it or not. If you do, find out why and then work on it accordingly. If you're not sure about something, do visit your dentist. Well, now that concludes my talk. Now I'll answer all your questions. The first question that I can see is, which mouthwash is the best for bad breath? Well, multiple advertisements claim that mouthwash alone kills bacteria and it can take care of bad breath. It is not true. It is only beneficial if you use it after a thorough toothbrushing and flossing, as the bacterial plaque present on the tooth can only be removed by using a brush and a floss. Another thing is that mouthwash generally contain alcohol, sometimes as high as 25%. And as I said earlier, alcohol dries up your mouth, which can actually increase bad breath. So be very careful with mouthwashes. Don't use them alone. Use them only after toothbrushing and flossing. And buy brands that have no alcohol. The other question that I can see is, I brush my teeth twice a day, but I still feel my breath smells bad. Why? Just brushing your teeth may not be enough. You have to clean your tongue as well. I hope you're cleaning your tongue. Like I mentioned before, that could be the main culprit causing bad breath. And if it still doesn't go away, you must consult the dentist to make sure it's nothing serious. The next question that I can see is, are chewing gums helpful in treating bad breath? Chewing gums do not treat bad breath, but yes, they can perhaps be helpful in masking bad breath for a little while. Also be very careful about the type of chewing gum you may choose. If your chewing gum contains sugar, the bad breath can increase even further. But yes, sugar-free gum can be used to cover up bad breath for a little time. To treat bad breath, you have to find out the underlying cause and treat that cause. The next question that I can see is, are there any house remedies? House remedies, well, you can use salt water gargles. It can help you eliminate bacteria from the throat and tonsils. And then there is fennel seeds. Fennel seeds, also known as saunf, can act as an excellent mouth freshener that can help with bad breath. It freshens your breath and stimulates the production of saliva. It also has antibacterial properties. Some people I know make and drink fennel tea as a couple of times a day, and it works very well. At home, you can also chew on cloves and parsley to refresh your breath. You can also try lemon juice. You can add 1 tablespoon of lemon juice into a cup of water and then rinse your mouth with it. You can also add a bit of salt and then use it. This is also antibacterial and it can also stimulate the production of saliva. Next question. Can bad breath happen in children? Yes, of course. Just like adults, even children can have bad breath. It can be due to usual causes such as poor oral hygiene, dry mouth, and bacteria on the tongue. Mouth breathing is actually fairly common in children. So if you see that your child often breathes through his or her mouth, please visit a doctor or a dentist. Sometimes it can be out of habit, which has to be corrected when they are young. Mouth breathing can lead to a lot of problems such as a dry mouth or tooth decay, and which can eventually lead to bad breath. So, and also if your child has braces, special attention must be given on brushing the teeth. If the food is retained in the wire or brackets, that can also lead to bad breath. In very young children, if they put a foreign object like a small toy, sometimes they put food in their nostrils, it can lead to a bad smell. I have seen kids where they have tonsil stones that can smell very bad. So if you feel your child has bad breath in spite of a good oral hygiene and brushing, please take him or her to a dentist. Another question that I can see is, what is the best way of knowing if I have bad breath? A lot of people think that they can identify bad breath by breathing into their hands, like they show it in so many advertisements. But it is not an efficient way to do it at all. Because when you blow into your hand, you do not use your throat. But when you speak, you use the throat, and the smell comes out of your throat. You can try the techniques I had mentioned earlier, like licking your wrist and sniffing it, or scraping the back of your tongue, or asking somebody you trust. But if you're still confused, please visit your dentist. The next question that I can see is, I think I have bad breath, but my husband doesn't seem to think so. What do I do? Well, bad breath can sometimes be psychological. You might feel you have bad breath when you actually don't. So you can perform the self-analysis test that I've mentioned before, or visit your dentist to confirm. The next question is, my friend has bad breath. How do I tell him without offending him? Okay, well, that's a tricky question. It depends on how close you are to the person. If he's your close friend, you can directly tell him, but be polite. You can speak to them privately and say something like, if the situation was reversed, I would want someone to tell me. So I thought I would let you know as well. You can also offer them advice regarding what they should or shouldn't do as they have bad breath. Something like that. But if the person is not very close to you, you can just drop in subtle hints. For example, you can pretend that you have bad breath and say, oh, I'm going to grab some water. I feel like my breath is terrible, And this may make them think about their own breath. Another thing you can do is you can give them a dental cleaning voucher or something. So when the dentist tells them, it will be much more effective. Just for your knowledge, these vouchers are available at Clover Medical Center as well. Let me know if this helps. The next question is there any particular food that is good or bad for bad breath? Yes. Garlic and onions top the list when it comes to bad breath. Other veggies include cabbages and Brussels sprouts. As mentioned earlier, if you have less carbohydrates in your diet, even that can lead to bad breath. Food which is considered good is green and orange vegetables, so make sure you have lots of those. Also apples or food rich in vitamin C such as red bell pepper and broccoli are good. They work even better to fight bad breath when eaten raw, as the crunchy produce of any kind helps to remove loose particles in your mouth, food particles. Also proteins such as nuts or beans and seeds are good and help in your keeping your breath fresh. Curd and yogurt are also very good because they have a lot of good bacteria that can help reduce the smelly bacteria, and it can be very beneficial if you have bad breath. Another question that I can see is, are there any diseases that can come from bad breath? No. Bad breath cannot cause any disease. It does not cause any diseases. But it can sometimes be a sign of an existing one. For example, bad breath may be a symptom of a gastric disease or a liver disease or even diabetes. Okay, this seems to be the last question that I can see. Thank you all for tuning in. If you have any more questions, please comment on the video and we will answer it as soon as possible. Or you can visit us at Clover Medical Center in Tecom, Bardubai and Al Nada. Goodbye. Thank you.